Well, the opioid epidemic is considered the deadliest drug crisis in U.S. history. Drug overdoses are the leading cause of death for Americans under the age of 50. Okay, let's get to our panel now. Former Los Angeles councilwoman Wendy Gruhl is with us, so too CNN political commentator and talk radio host John Phillips, also Trump supporter. Also have addiction treatment specialist Howard Samuels. So, Howard, first to you, notably the president, he declared a national public health emergency, which stops short of a national emergency. The administration argues that's a distinction without a difference, but a public health emergency doesn't release any extra funding, and the president didn't request any on Thursday, so it's a lot more than just a distinction, right?
Well, I gotta tell you, all this is a photo op. I mean, you know, I'm on the front lines here in Los Angeles at my treatment center, the Hills Treatment Center, and all I know is private insurance gives 15 to 20 days inpatient care for a heroin addict or an alcoholic. Doesn't make a difference. The government insurance, Medicare, gives 3 to 4 inpatient days. So what are we talking about? The whole system is broken as far as treatment is concerned.
Wendy, to you, you hear Chris Christie say that the president deserves praise for the bold action.
It's really not bold. It's kind of been a pattern where the president will say, I want to do something, but I'm going to push it off to Congress to actually find funding.
And now, to that point, I mean, you hear, and you know you're on the front lines, but you hear what the president said, calling it a public health emergency, and then you also hear him talk about, you know, big, bold advertising, effectively just say no, so people just don't start down this road. You heard that today and thought what?
Well, you know, it's about education, it's about treatment, it's about interventions. The heroin epidemic, the opioid epidemic has been here for a long time. It's been years, okay? And it's just gotten worse. And like I said, you know, before, it's now through every community, rural, city, suburban area than it was 50 years ago. It's not going away. We've got to treat it. And that's what we got to do to solve it. And these ideas about more money, well, where's the money going? We ought to have government-sponsored treatment programs that are locked-down facilities where the addicts have to spend at least a year in treatment, not 3 days, 20 days. I mean, it's a joke.
Okay, well, the New York Times editorial criticized the lack of funding, or additional funding, and then added this. Combine this with his, as in Donald Trump's repeated attempts to gut health care for poor and middle-class Americans. And the president has offered few tangible solutions for a scourge that now kills about 50,000 Americans a year.
Well, I think it largely is the public relations campaign that he's putting on. So they'll see it on the front page of their paper. It'll be something that they talk about. But in terms of fighting it, I would go back to the future. What did we do in the 1980s? We went after the drug dealers. Right now, I'd go after the doctors.
How the problem that we have right now is that, you know, Johnson's go after the drug dealers, but you have a member of Congress who was nominated, or the Trump's picked to be the drug czar, who is actually helping Big Pharma by weakening the laws of the Drug Enforcement Agency so they could distribute more opioid pills around the country.
Well, I mean, that's why, you know, this whole administration and the way they're handling it is a joke. And I've got to say, I used to be a heroin dealer. I mean, I'm a recovering heroin addict. I used to sell heroin. So it's not so much the dealers, most of them are addicts trying to support their habit. That's why we need to educate. It's the cartels. And it's not just about the pills anymore that the doctors are doing, which is beyond the beyond. But there is heroin by the cartels in every community in this country. What's going on?
I mean, Wendy, it's a multi-layered
It can't be just a public relations campaign.
President Trump made a very rare mention of his older brother, Fred, who was an alcoholic, struggled with addiction, and died aged 43. Listen to this.
I had a brother, Fred, but he had a problem. He had a problem with alcohol. And he would tell me, don't drink, don't drink. He was substantially older, and I listened to him.
Howard, clearly, you know, Donald Trump understands the pain of addiction, but what he seems to have the emphasis on here is educating kids before they actually have the opportunity to start using opioids or abusing heroin. In his case, just don't take up substances, or so you're vulnerable to substance abuse. What seems to be lacking is the immediate empathy and care and treatment We just need it right
Exactly.
now.
Well, exactly. And, you know, if you get arrested for heroin, like I did in the 70s, I was given a choice of 4 years in prison or a year in rehab. That saved my life, okay? There's got to be a combination of government and law enforcement that pushes the addict into treatment against their will. Because the addict, like I was, we were crazy, okay? And if we don't do something to intervene in a very strong manner on the treatment level, there's going to be a lot more dead people.
We're out of time. Wendy and John, thank you. And
Brilliant.
also Howard.
Howard,
Thanks so much for coming
appreciate
back.
it. Thank
for a
you.
second
Thank
night.
you.
Appreciate it.
Well, we have extensive coverage of the opioid crisis in the US on our website. That's all for you at cnn.com/health.